Value-based healthcare benefits patients and caregivers alike, supporting resilience and achieving quadruple aims. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm your host, Tom Petterly, with AHA Communications. This is part 2 of a series featuring speakers from AHA's most downloaded podcasts. This one is moderated by the AHA's Elisa Arispaco-Chaga, Vice President of Clinical Affairs and Workforce. In this podcast, Elisa is speaking with Brooke Buckley, Chief Medical Officer of Henry Ford Wyandotte Hospital, and Dr. Hirsch Trivedi, President and CEO of Shepherd Pratt Health System, about how a culture of value supports resilience across organizations and teams, and how clinical training can combine with one's leadership journey to guide that value. This session was recorded as part of the Architecture of High Value Healthcare Conference, which AHA co-sponsors with the High Value Practice Academic Alliance.
So, Brooke, I'm going to start with you. How do you, in your role as both a surgeon and now leading a team as a CMO, really think about fostering a culture of value, and how does that bring support to your team?
So, there is no one way to do this work, but truly the first and most important step is listening to the team, listening to the stakeholders. And I guess, before that is identifying who those stakeholders are. And oftentimes the people that seem obvious, there's a whole nother layer of people that are essential to the team. And certainly, during the last 18 months, we have doubled down on our understanding of, for instance, how important our environmental services workers are to the safety and infection maintenance in the hospital, as an example. But truly building trust through listening to each other, through learning what the day-to-day work and struggles are of our individual team members and stakeholders is a way to make sure that we're asking the right questions. Because to get to value, which isn't necessarily an obvious jump from where any of us sit in our particular roles, we have to be speaking a common language. And I really appreciated the previous segment conversations with lots of different ways around change management, around failure and innovation, and the ways that we use language, making sure that we have a common way that we all can understand so that we can have productive conversations. And I think the third thing that I'll add is truly some version of a visionary leadership. And to be certain, each of us are leaders in our own roles. And so even in any of the working groups in a hospital, there are titled leaders, but there are also leaders in those groups. And moving people forward where they can see what the future might look like, where we can use our imagination, if you will, to dream what that future might look like so that we can take those small incremental steps to get there. If we can't believe in it, there's no way we're going to find our way there. So that trust to build those stories, to move in that direction with the right team, truly the way to build that process from my perspective.
Thanks so much. And Hirsch, I know you lead I believe it's the largest behavioral health system in the state of Maryland, and especially over the last 18 months, this has been a huge discussion across all of healthcare, both the resilience and the mental health and the well-being of our teams. How do you foster that culture of value in your hospital and health system, and how do you use this work to support your own teams?
I fully agree with everything that Brooke just said. The big thing that I would say is, first of all, as a physician across all care teams, and I would say including in the non-clinical areas, the real question is, how do we deliver the best care? It's a fundamental, simple question, but it's one that really gets people going. And I think one of the things that I do all the time, and I do this in environmental services and in finance, and how do you connect back to the primary mission of why we exist, right? What is it that you do that helps us deliver really good care? And I think how you foster that culture of value throughout COVID, I've had this kind of mantra that I keep on telling to our leaders. So we have this weekly call that we go through, about 250 people are on the call. And I focus on two things. Part of being a leader is, particularly during times like a pandemic, we shoulder a lot of the anxiety that others have. But more importantly, the second part of it is it's our job as leaders to figure out how we remove obstacles for others. There is no way, particularly during a pandemic, that you can lead top down to make all the things happen that you need to get done. What you really need to do is empower from the bottom up. And how you empower people is you basically start with one simple question. That simple question is, what gets in the way of you being able to do your role better? What gets in the way of delivering better care? What gets in the way? If you ask what those barriers are, the reality is the value solutions pop right up. And I think one of the things that's actually been liberating about COVID has actually been because of a number of emergency waivers and other things that have happened, we've been able to basically scrap some of the things that we said, well, these are the shackles that hold us down, whether it's regulatory, whether it's how certain care processes have to happen, or even how appointments are scheduled. And we just say, okay, here's the problem. How do we fix it? And I think in terms of fostering that value, what you have to focus in on is really what's core to actually delivering incredible care. The next part, and I think this is the part where kind of how does it help our teams? The biggest thing I will say, and this is not just for physicians, but I think across all of clinical medicine, it's really that sense of loss of autonomy. And so when you empower people to actually have the ability to have some input into how their day goes, how they can impact what good care looks like, not only is it empowering, it's why people show up for work in the morning. If at the end of the day, you can feel like you did something tangible that helps you feel like you made a difference, and that goes across every single role across our health system, that's what actually helps people feel good about what they just did. And I think it's exactly like everyone else has mentioned, to have a place where not only is there enough trust, but you can have the conversations where people can disagree to come really to the best solutions. Those are the things that allow many more people to have input. And when people can see parts of their ideas play out in different solutions that come up, all of a sudden you have a little bit more spring in your step. And I will say, particularly during times of COVID, we are all looking for what's the bright spot today. And I will say, yes, it's been difficult, but at the same time, none of us want to let a coworker or a colleague down. And so regardless of how things kind of work out, it's those teams that make a difference. And then I'm going to end lastly by saying, to really empower value to happen, as leaders, you have to change the culture of the organization, where I think in many places the feeling is, it's death by a thousand no's, or, it's death by committee. And really, as leaders, we have to push this notion of how can we get to yes? How can we say yes to as many things as possible to move as much things forward? And I think going back to the comments from before, medicine needs transformational change. And the only way we're going to get there is all of us doing our pieces. And honestly, that means there's a lot of opportunity for many of us to have input along the way.
I couldn't agree more. I think absolutely. I know you all many, many years in school specifically to be able to help patients. So anything that gets in your way just really is shackling you, I think is a great way to describe it. Let's talk a little bit as clinicians, as your own paths have evolved into leadership. How has that focus on value helped to feed your own well-being, and how does it help you move forward? Brooke, let's start again with you.
Such a great question, because again, so many of these points in space we try to draw together that aren't necessarily obvious when you set out the door to go on these journeys. And value for me, the linkage between quality and overall ability to provide the care and the quantity of work that we are trying to perform. You can't really talk about that without considering the ways that we each draw from the system and we each give to the system. And I really was struck by the last comments about humble leadership, and thinking that where I always tend to go is towards humanity. COVID has really reminded us is about how we are all in this human condition. And that HUM root, the home root, is really in groundedness. And so I think that the value proposition as it relates to sort of a total well-being and a more global perspective, especially now in 2021, as it relates to that we are all connected, and whatever resources we waste are resources that somebody else doesn't have access to. And so, as physicians, there are times where we are inefficient because it serves other work that we're doing. Or there are times that we're inefficient because we're just tired and it's hard to move at the pace that we need to move at. And I think those are the places where we can innovate together, come together, wrap our arms around each other, and put our resources together to find those innovative, those transformational solutions where we can get this work done and we can get it done for everyone in a way that's fair, in a way that serves even the most underserved. And the gift, the silver lining, as it were, of this incredibly difficult exercise that we're going through truly is being able to sort of shift our lens a little bit and look at these questions with a new enthusiasm and honestly, a new awareness of just how crucial having these conversations are. I think of a specific example just to try to bring this into a little bit of clarity. We in my hospital have a significant amount of what's so-called white space on the operating room board. So spaces where there's downtime, where we have staff and we have availability and we have rooms, but we aren't necessarily doing cases. And as we think of culturally shifting towards shrinking that white space, for many physicians, potentially that means moving the times of their cases. And that feels like a give. That feels like a disruption in the way that we're delivering care. But from a broader perspective, to be able to service the most number of people and allow our hospital to deliver the most close to home care, taking some of those efficiencies out of our system in a way that we have collaboration around the how is truly how we get to that place where we are creating value and driving people's well-being and their connectedness to that whole in the process.
Absolutely. I think it makes a huge difference to get everyone, as we've said several times, involved on the front end and really understand what everyone's goals are and how can you support your team by giving them more time back, even when they don't think they need it. Hirsch, how about you?
So I would like to kind of focus on two specific parts of that. So I think the first one is a lot of times when we talk about value, people quickly jump to this notion of like productivity, how much stuff are you getting done? And then there's always this cost as a denominator. I kind of think about it differently, and I can think more about what are we doing that actually advances care and are the things that we need to do versus what are all those things that are non-value added. And so it's really, how can you take away the things that at the end of the day will not result in better patient care? And when I think about it that way, you end up not having to deal with as much of the who's going to lose a job, what's going to happen. Because the reality is there's so much need in every single one of our communities that the reality is we need everyone. And if anything, we need to be growing multiple more of whatever role we're talking about, right? The second concept that I bring into it, and I think this gets back to your question about like, what's the journey been? One of the things that I will just say is, I went through medical school. My entire education was based on like, how do you make the most broad differential diagnosis? And then how do you kind of hone it down to like the one solution as to what's going on with this patient? I went to business school after that. And all of a sudden my brain exploded because then what you learn in business school is, hey, there's actually like 17 different right answers. The question is, how many resources do you want to kind of devote to doing it? And then what are you going to expend, whether it's political, it's capital? And so what you come to realize in all these decisions is, I think really in terms of wanting to drive value and how do we get more involved, first of all, we have to be at the table. So you can't simply just complain about things, but then not show up to the meeting. You have to be at the table. The second thing I'll say, and I think this is the thing that's been the most true for my career, is when I come to that table, I don't want to bitch and complain about what doesn't work. I want to sit there and focus on what are the solutions to actually make it better. And if you want to figure out how to quickly have a lot of positive interactions with your hospital administration and getting things done, it's how can you be solution focused? And I will say, my career started off being a hospitalist. It's what I've done for the vast majority of my clinical time. And it's always been about how do you improve processes? How do you get people admitted easier? How do you get them discharged faster? How do you get them to the right test? And the reality is in any given day, there's probably about 100 things that we can solve that each of us experience. And I think to start that value journey, it's simply how can we do something to make it better for the patients, for ourselves, for our teams? And if you remain on that positive trend of saying, how can we make a difference? And then how can it actually move care, not just for one patient, but across a unit, across a system, across a population? I'm in this, position now. As you mentioned, we're the largest nonprofit provider of behavioral health services in the nation. We have 387 sites of care. If I want to move care across that system, I have to have people across all those locations being empowered to make that difference. And so when you flip it on to how does any one of the people watching this enter that journey, you can be an agent of change to improve it right locally where you are. And if it's a good enough idea in the right organization, it should grow to the level where it does impact populations.
Can't agree more. Absolutely. And I think we're slightly, I'm sorry, Priya, we're slightly redefining value for you as really being empowerment. But I know we have a few minutes left. Let me ask this, and I'll come back to you first, Hirsch. What is the thing that COVID taught you about how you can, going back to the question that both David and David also answered, about how we need to change how we work and how that can bring more resilience? You started to talk about it, and I'd like you to expand on it a little bit more.
Yeah. The biggest thing I will just say is the most horrible thing and the best thing about COVID is you can make all the plans you want. You'll get to the perfect thing about how you're going to do testing or vaccination. And you can be well assured that 3 minutes later, someone's going to get it on a TV screen somewhere and change all the rules again, right? And so what that's helped me realize as a leader has honestly been, how do you create a nimble organization? How do you have a role where you can really, I'll say, use the best qualities of so many members of your team? And it's this interesting thing where oddly during COVID times, people walk around like, we are making miracles happen every single day. So whether it is access to beds that otherwise teams wouldn't have figured out, or how to make one more ICU bed available, or how to get a respirator, or what do we do about getting a test, we've been able to empower people. And I think part of that, and I fully agree with the comment made earlier, which is that I don't think care is ever going to go back to what it was, nor would I want it to. And I think one of the best things I'll just say is the loss of all of the formal structures where you had to go to through 17 layers of decision making. Be nimble, fast fail, get to a solution. If the solution works, see if you can replicate it. And I think having that culture where people are okay with that, and the fact that we're going to try something, and just because I did it, it doesn't mean that I'm stepping on Brooke's toes, or that I think that culture is one that we have to make sure we hold on to and keep on giving people even more ability to do that as we come out of the pandemic.
Absolutely. Brooke, I'll give you the last word. How do you think what you've learned in COVID is going to help you foster that culture and keep moving forward, change the workforce?
So much that we've learned through COVID, but for me personally, seeing us all in the greatest stress of our personal and professional lives simultaneously has really just brought into focus that we are all undergoing so many journeys and so many issues, conflicts, personal wars, however you want to describe that at any given time, and really tapping into the connectedness that we all have to appreciate that it's not what you are doing or what he is doing or what administration is doing, but it's sort of what is constantly being done to us, if you will, as one of the David said, that change done to you. And that's being more and more discussed in terms of trauma-informed care. And I think as we deal with each other and we manage each other through this process, understanding that approaching each other, knowing that a lot has been done to each of us and to our system, and looking for that agility, that balance, that really staying present in the current questions, the current moment, not trying to go back to where we were, but recognizing that we all are always constantly moving forward. And even though the pace has been ridiculous for the last 18 months, that at some level, those lessons learned and continuing to grow with those moving forward is our real opportunity here to deliver that best, safest care in our next iteration.